talk about something fun, such as feedback, which you guys do a lot of, and you're great at it. And there's lots of feedback to come as we have new third years starting August 3rd, which is very exciting. So first, I want to just do a quick review of how to set expectations and just a quick reminder of how important that is for new third years and for your fourth years on the team. Review some basic feedback practices, discuss maybe how to think about feedback a little bit differently since we may not all be together in the same team rooms, and talk a little bit more about how we should use feedback moving forward. And so first, I just want to remind everyone that what we say, how we say it when we're in our teams, when we're working with students, when we're working with patients, words are really powerful. And this is kind of that hidden curriculum. How you say things, what you say, how you label patients, all of those things can teach something that you may or may not intend to teach. And so we all have frustrations. We all run into situations that, either with a patient or team dynamics or just feeling tired in general, the busyness that are the services. There's a time and place to air frustrations. And remember that students are here to learn, and everything that you're saying, all of the communication that you're having, whether it's behind closed doors in the team room or with the patient, you're teaching the students something with how you say and what you say. So just be really thoughtful and mindful about the language that you use all the time, but especially as we have new learners that are coming back from, several months of online learning and haven't yet been in the hospital setting. And so the third years are, there's probably some anxiety, there's some nerves, there's excitement to be back in the clinical environment. And so just make sure that you're mindful of what you're saying. I just want to take a minute to remind everyone that setting expectations is really important. I know that third year students show up like almost at the end of rounds on that first day after they've been to orientation. It's always the most inopportune time to have a gaggle of new students show up and need to be oriented to the team setting. It creates a little bit of a challenge. And so, the way I approach that situation is I welcome them, glad you're here. We're in the middle of rounds. I, introduce everyone on the team, have them introduce themselves, and continue on with the rounds, stating that, as soon as we're done with rounds, we're going to sit down and talk about my expectations for you. And so you as a senior resident, make sure early in that first day or that second day, you're setting these expectations. And it's the basics, like what do I wear? When do I show up? Who do I call in the morning? How many patients should I follow? Who do I present? The real basics of what you expect them to do to be successful. And remember, some of these expectations are going to change. They're going to look different for that first month of third year in August versus an experienced third year in May who's almost an AI. And so just making sure you're tailoring your expectations to the learning level of the student. Another really important thing, I want to make sure you're empowering your students so that they know who to call. If you have a third year student that's going to show up at 4 a.m. and start pre-rounding, which some of you may, and they see a patient that doesn't look right or a lab that doesn't look right and they're worried, who do they call? Do they call you in the morning? Do they call the MAR? Make sure you're equipping them with the contacts and the know-how of what to do. Remember, teach your students how to actually page someone on the paging system, the real basics. Remember to tailor what your expectations are with what the learner needs. And this kind of goes along with getting to know, familiarizing yourself with what the goals and objectives of the third and fourth year curriculums are. And those are all on Canvas, Blackboard, and sure the chief can resend them out just so you have an idea of what topics the students are expected to learn that have been set by the curriculum. And third year students have different needs than fourth year students, and tailoring what you're teaching, what your expectations are to meet some of those needs is really important. So then it gets to feedback. Feedback is such an important part of how learners grow and become better physicians. And there's a lot of reasons we don't give feedback. This list actually comes from a survey I did about 2.5 years ago for all of the fellows and residents across MedStar. And number one, hands down, time is time. We just don't feel like we have time to give feedback. Often not sure what to say, worry you're going to hurt feelings. You have to work with the student for a month, maybe again in the future if they're interested in doing residency at Georgetown. So you don't want to damage your relationship with a team member. You're worried that the response from the learner is going to be really defensive, or maybe you see a lot of things that need to be corrected, but you don't really have the skill set. You don't know how to start the process of suggesting ways to improve. And so I'm going to break some of these barriers down a little bit so that we can all be better at providing feedback and in real time. So first, I just want to remind everyone there's different types of feedback. I think a lot of times when students hear the word feedback, their first thought is my grade. And there's a lot more to feedback than just that final evaluation or final assessment. And feedback sessions don't have to be these planned out 20-minute talks that are very important and should happen at some point during the rotation, but you're giving feedback constantly. You're doing it all the time. You're appreciating how hard they work. Thanks for taking care of, getting the outside medical records. Thanks for summarizing that. Thanks for helping with the discharge paperwork. Thanks for doing such a great job talking to that patient's family member. All of that sort of appreciation is a type of feedback that says, like, I see you, I hear you, thank you, I appreciate you. And we all need to hear that from time to time, especially when we're on these busy services where the stakes are high. The other type of feedback that I think you're doing constantly, whether you recognize it as feedback or not, is that you're coaching. And so you're giving tips, tricks, things that have worked for you, things that didn't work for you, teaching students how to broaden differential diagnoses, like kind of playing the what if game. What if the white blood cell count was 25? What else would you worry about? What if, this chest x-ray showed a layering effusion? What else would you think about? So you're doing this feedback, this coaching, this skills development constantly. I think one of the things we just don't typically call it feedback. So when you're going to do some coaching on a student's H&P or a student's presentation after rounds, use the word feedback. Say, I'm going to give you some feedback on your assessment statement. I'm going to give you some feedback on that exam that you just presented. Just keep throwing in that word feedback so that students at the end of a rotation don't come to Dr. Okuliar and Dr. Gandhi and say, well, no one on my team ever gave me feedback. Because you know that you're doing that constantly every day. Just throw in the word feedback. And then that final evaluation, and that's important for setting expectations for your students of when you're going to do a more summative evaluation. Usually the hope is mid-rotation and then again towards the end of rotation. If you wait until the very end of your 4 weeks and you've identified this long list of skills that a student can improve upon, but you don't give that student time to take your feedback to heart and practice that skill set and prove that they can get better, then you're not giving them a fair chance to develop based on the feedback you're giving. So make sure you do feedback early and often. And I also want to move away from the thought that feedback is either good or bad, right? Everything that we're saying in feedback is a constructive comment to improve a skill set. And if the language you use is neutral, and if the overall goal of feedback is to improve their medical education, their knowledge base, or their skill set, then the students are going to see that feedback as a professional development conversation, not good or bad. So let's go through a few tips for providing feedback. And there are lots of different mnemonics, there's lots of different papers, there's all kinds of different ideas out there on how to provide good feedback. And this paper is from the medical teacher. It actually has 12 tips. Anyone that's interested in reading the whole paper, I think it's great and it kind of simplifies everything. I've picked out a few of the 12 just to highlight. The first thing is maintaining that positive learning environment. If we're talking about difficult conversations and constructive comments, if it's all done in a positive environment where everyone has the shared goal of improving a skill set, those conversations become much easier. A positive learning environment promotes a setting where it's okay to not know the answer. It's okay to ask questions. It's okay to get something wrong. And if students are seeing you look something up or know that you don't know the answer, you know, you making improvements based on maybe feedback from your attending, all of that is going to set the stage that we're here to learn and we're here to grow together. Going back to my, 2 slides ago, communicate the goals of feedback. Just throw out that word often. I want to give you feedback on your conversation with Mr. Smith. I want to give you feedback on the order you placed for insulin. Just throw in that word. You're doing the feedback anyway, so use the word feedback and state your goals. I promise the students' ears perk up a little higher. Their attention is a little more intense when they hear the word feedback because, again, unfortunately, feedback is always associated with this idea of a final grade. It's much easier to provide feedback on things that you observe directly. Leave it to the chief residents you're attending. If there's some issues that you hear from nursing, some other maybe behaviors or things that you're worried about that maybe you didn't directly observe. So if you saw an interaction that didn't go well, you can just comment. I want to give you feedback on that interaction with Miss Smith, the patient in room 8A. I want to give you some feedback on the exam that I just saw you do. The things that you observe directly, it's much easier to be objective about the behaviors you're identifying and the statements you're making, and makes that conversation a lot easier. Feedback needs to be time sensitive. So if you, again, wait until the end of the rotation to give feedback, then you're not giving the student the opportunity to show improvement. On the flip side, many of you probably heard me say this before, if you're really upset about a situation, probably giving feedback in that moment isn't the right time. It's the equivalent of the angry email that you can't get back. And that's where there might be some damaging of relationships or hurt feelings that can be avoided if you take a moment to process the information and come up with a plan of how to present that information to make that conversation more effective. There's also times where you can't give feedback in that moment because patient safety comes first and there's something that needs to be attended to immediately or a mistake that needs to be fixed immediately. And so giving feedback in that moment doesn't make sense because you have to make sure that the patient is safe first. I think it's really important to address self-assessment and overall goals of what the student or learner wants. And so oftentimes I start those mid-rotation feedback sessions or end of rotation feedback sessions with, how do you think it went? And I tell the student that I'm going to ask them about their impressions so that they have time to prepare. I think that when having these conversations about professional development, it helps to align goals. So if I know where that student is in terms of their needs assessment and their self-assessment, I can help align the feedback, the coaching, the mentoring that I do to really address their goals. And I can also add in things that maybe they haven't been able to assess on their own that I've noticed about their performance. And so, but it's all aligning goals towards improvement in their skills as a physician. It's important to confirm understanding or acceptance. So just kind of summarizing the plan, summarizing the topics that you want to address for next time. It's also okay when you have a situation where you have to give really constructive criticisms and feedback. It's okay to say, it's really hard to hear this. I know you're working really hard. This feedback can be tough to hear, but I really am invested in your education. I'm invested in your your career, and I want to improve your skills. And so it's okay to address that because we're all working hard. The stakes are high. No one went to med school just because they thought it would be an easy walk in the park. Um, and so addressing those emotions are important. And then have an action plan. This is especially important for if you give some coaching tips, if you do that mid rotation review with your students, have an action plan on what they can improve upon and what they can work towards to present more clearly, have a more expanded differential diagnosis, perform a better focused physical exam, whatever that um, skill is that you've identified that needs improvement, come up with a plan. So back to my self-reflection just for a minute. These are some of the questions that I often use to help get the students to start thinking about their own performance and help aligning my expectations with their expectations for next steps. So what went well? Um, how do you think things went? What could you do better? What do you want to work on? And then have that follow-up or check-in. Um, I often get a lot of really interesting comments when I ask, what do you want to work on for next time? Because sometimes it's things that students are struggling with that I have no idea because they're doing a pretty good job, but maybe their organization, their framework of how they're approaching something doesn't quite click, doesn't quite make sense, even though the end product looks okay. And having an idea of what they want to improve upon really helps me direct my coaching and my feedback to improve that skill. And, I think self-assessment is great, but I think that we do have to remember that not everyone is great at self-assessment. And this Dunning-Kruger effect is a concept where those students that are in the bottom quartile here often perceive that their perceived ability and their perceived test scores are actually a big discrepancy from where they actually test, which is in the bottom quartile. When you get to the average and high and the high achieving groups, they're much more aligned. And I think for the most part, many people that are in medicine fall in this higher achieving realm. You have to get into medicine, but do know that there can sometimes be a big discrepancy. And that's okay, because when you ask that question, how do you think it went? If you, in your mind, think that was the worst presentation I've ever seen, and the student says, that's the best presentation I've ever given, you know that there's a big gap and you know where to start that conversation to meet the student to help improve their skill set to get them to where you think they need to be. So, I don't have a perfect answer or solution to how we're going to do some of these conversations when we're physically distanced. Um, I think the time of having all the students sitting in the team rooms and having the whole team together is not going to look quite the same when all of the third years are back. And so setting the expectation of when those feedback sessions or self-assessment sessions are going to occur is important. Do you want the student to send you an email every Thursday afternoon so that you have something to talk about Friday that has their self-assessment? Do you want to do video check-ins with the students for that mid session, the mid rotation check-in? I think it's going to work a little bit differently, but thinking through things that work for you is going to be important. And then if you come up with a system that works really well, whether it's email or quick Zoom meetings with your students, give feedback to the rest of the group so that we can have so we can learn from your experience as well. One of the things that I do really to make sure that the feedback I'm giving is based on my direct observation, based on specifics, is I actually take notes on the back of my patient lists when I have students. And I'm writing down their names, I'm writing down specifics of things that they did well or things that I want to talk about later in the afternoon when I have a chance with the students. It helps give me a reference. Then sometimes I forget all of the details and all the specifics when I'm sitting down to do the final evaluations. a week or two after the rotation. And so I always refer back to my notes, which can be really helpful to making sure that you're giving specifics and something to grow on for the students. So I want to take just a few minutes to talk about final evaluations, because you as residents are going to have a big role in the final evaluations that are submitted for the student's grade. And going back to making sure that you have specific examples is really important. The great job, great team player, read more, at expected level for where they are, those sorts of comments don't give the student anything to grow on. And so one of the, I won't call it cheating because I think it's using my resources wisely, is refer back to the actual language that's in the evaluation. So think of those specific examples and then look at the language that if you're grading the students on 1, 2, 3, 4, 5, if you think that they did an average job and they deserve a pass, that's equivalent of a 3 on the student evaluation. A 4 is a high pass and a 5 is honors. So look at some of the language that's used in those boxes that you're checking, and that can help you formulate a much more thoughtful comment and help give the student a skill set to strive for next time. So have an action plan. What did you notice that they can improve upon? What do they need to practice? Is it presenting? Is it speed of presentations? Is it focused physical exams? Is it expanding differential diagnoses? Be specific about what you think they can improve upon to get to that next level. What knowledge gap did you observe? This answers that whole question of like, read more. Great, read more what? Do you want me to read more People magazine, or do you want me to read more about acid-base problems? So if you notice a knowledge gap, state that, and then that can give that student something to read more to get them to the next level. And then when you have those residents that really seem to tick all the boxes, meet all of your expectations, meeting all the goals and objectives set by the clerkship, what do they have to do to get to the next level? Should you try to get them to teach the whole group about hyponatremia, or teach the whole group how to do a focused physical exam? Do you want to have that student lead the team when you go in to see a patient together? So think through what would be elevating the student, or what your expectations would be for a fourth year or an intern, and challenge the student to meet that goal. So back to my statement on using the evaluations to help you. So if you think the patient is a high pass, then you can look through some of this language and you can say that the student is really thoughtful about their presentations, they're organized, they're concise, they are able to interpret data and highlight facts that are really showing that they understand the situation or the diagnosis. And so use some of the language to really help improve your evaluations. So kind of thinking through that framework, I want to take a few minutes to work in groups. I think some of you are still in, let's see, I can, still in groups, and those that are not in a shared conference room but on their own phone, we can unmute and kind of have a conversation about how are we going to provide feedback to these students. So you have Lindsay in AI. She matched into surgery. She comes late, leaves early. She doesn't seem to know much about what's going on with her patients. She doesn't seem engaged on rounds. She's not helping the third years. When you question her about her presentation, you think that, oh my gosh, her medical knowledge is not at all what I'd expect for a student at the end of fourth year. You kind of remind her the expectations that you have for AIs, but then the performance still doesn't change. And so you need to provide some feedback to the student. Where are you going to start? What are you going to choose to provide feedback on? And I'll let you guys talk as a group in some of the shared rooms, and then maybe we'll open it up for some discussion on where to go with this scenario.
Sure. Did you want us to make breakout rooms?
Sure, we can do that if that makes the most sense.
Yeah, give me a second. We can do it.
Okay.
How many?
I don't know if I'm a host, but
Here, I'll do it. 3. Yeah, 5 to 6 per room. Create rooms. Judges. All automatically. Hey. How's it going, Leah?
Good.
You
This
all
is,
wired up with headset.
I know. I
I'll
need
move,
AirPods.
no, actually, those probably work better. I'll move you to breakout room 2.
Okay, I was in one, but it doesn't matter.
Huh?
I was originally in one, group one.
Okay, you want to go back to 1 then? Okay.
Yeah, that's fine.
and it's us again. I'm going to tell him to end it. Everybody else is finishing up.
Okay, my
That's
group
the
had
most jarring thing about Zoom.
yeah, I know. Well, hello everyone. My group had a great conversation. I don't know if anyone from any of the breakout rooms want to give their overview on some pointers for everyone.
Our breakout room said they kind of talked about asking open-ended questions and seeing if there was anything else in their life that was affecting them. Kind of just started with like, "Hey, how's the rotation going?" or "How what's going on?" Things like that.
Yeah, no, I think that's great because this could be a situation where there's something else that's just distracting and maybe you're the first to kind of see this gap in what they should know and what their performance is. And then you can help get them to Dr. Akuliar or one of the chief's clerkship directors so that they can address whatever personal situation may be interfering with their ability to learn. The other thing we talked about was making sure that we're aligning goals. So maybe the student just doesn't think that they need to know anything about internal medicine and wants to cruise through the rest of residency. And we talked about how reminding them, you know, they're going to be a surgery AI, or a surgery intern. They're going to be running the floor and managing all of the medical issues on their surgical patients on the floor. And so realigning those goals with how they can serve that role as in their AI role can really turn the switch and create better engagement. So back to aligning expectations. Okay, so let's talk about another one real quick, and then let's see. So you have the best fourth year med student ever. The student has gone above and beyond, finished all the discharge summaries days before the patient's going to be discharged, somehow even knows what the discharge meds are going to be before you've made the final decisions. She's great communication skills. She's more than prepared for rounds every day, even has like checked in on her third year med students, patients, and given them some teaching points before round. You're not sure if she ever sleeps. Now she sits down and wants some feedback. Can we go back to breakout rooms to discuss? All right, welcome back. I think the VHC group came up with a great overview, if they don't mind sharing.
Now we're unmuted. Go for it, man.
Okay. Our team discussed that for this particular student, it would be a good idea to challenge her to reach the next level of learning. And so challenging her to start presenting plans both to the attending during rounds as well as to the patient, bringing in studies to support her reasoning for why she wants to do what she wants to do with these patients, using those same studies to teach junior students as well as the residents on the team. And then we said that we'd want to make sure that we leave time and promote an atmosphere for her to introduce anything that she thinks might be a relative weakness of hers, and just make sure that what we're seeing on the finished product side of things isn't like costing her so much time and energy that she's not having any sort of chance to sleep at home. Making sure that like everything is being done in an efficient way, just to give her an opportunity to say, hey, I'd like to improve on these things, and making sure that what's the phrase? The what goes into making the sausage isn't so ugly to make this a nice final product.
I have not heard that phrase, but it is excellent. I love that. It's amazing. Thank you so much.
Yeah, excellent. And there's just one more scenario that I want to, let's see, go through here, is giving feedback to your attending. That's something that in past feedback sessions we haven't really touched upon, and we can do this all as a group because we're short on time. But say you're on service with me, there's lots of sick patients, you come in and I've already bolused the patient, I've started antibiotics, I've called all the consultants all before rounds. I text you all day what the plan's going to be and what the next steps are. And you're really trying to develop your skills as a senior resident and maybe feel like that's a little bit too much oversight. And so being a good attending, I say, hey, let's talk about how things are going. How do you as a resident start this conversation? Because I know this is a hard one to start. Any thoughts?
So I think you can sort of first recognize that you appreciate sort of everything they had done for you, like in that morning and helping you out, but also sort of leading that you're also sort of actively trying to learn and try to manage patients. And so maybe next time if we could just talk about the plan before first like just diving right into it, that way we can sort of work on it and go through it together. Just because maybe you can say that if you're maybe an intern, you haven't seen it before, and so you want to sort of learn as you're doing it. You appreciate next time if you can go through it together, but again, recognizing you appreciate all the help that they've been doing that day, and maybe try to frame it something like as that.
Yeah, no, I think that's great. And I think going back to aligning goals. So if you state to the attending, like my goal for this month, this is my last wards month as before I'm an attending, and I really want to see if I can be independent. Right? Setting your goals to get out of the month is really important. And creating that, like what support you need, knowing that there's support there, but state what your goals are. And I think that's a good way to start the conversation as well. And I think we're out of time. The last piece that I want to leave you with as new third year start is that there will be many that are scattered and all over the place. And you will see a long list of things that you want to provide feedback on. That can be overwhelming. So when you're going to do those coaching and feedback sessions, and pick one thing, especially early on, that you want your student to focus on, pick something that's high yield. if you give them a long list, it's overwhelming. And so be specific, pick one thing, come up with an action plan, give them a chance to show that they're taking the feedback to heart and improving. And then you can, the next day, pick another thing. The list will be long, I promise you. But if you remember back to your first day of third year, where that whole idea of a SOAP note was beyond a challenge and this daunting task, to the end of third year where you can crank out 3 or 4 SOAP notes on your patients all before rounds. The third years learn a lot in that first year, and because of the feedback and coaching and mentoring that you guys do all day long, every day.